Hi guys, Sasha again. The reason why I thought it was important to do this video is because a lot of the other videos that I have seen just give really basic information. I think the more information you have about exactly what endometriosis is, how it works, how the hormones affect it, you're better able to make decisions about treatment and you understand it more, so it's not something that's so scary and oh my gosh, there's no cure, what's going on. If you have more information about it, it makes it easier for you and you're able to explain to people better and feel confident in explaining it. So in this video, what I'm going to do is I'm going to take a bit more of a scientific approach. I'm going to explain the menstrual cycle first, because we know that endometriosis is linked to the menstrual cycle, and then explain how the hormones that make the changes in the menstrual cycle, how those hormones affect endometriosis. So I'm bringing you from the ground up. You can skip through all the initial information about the menstrual cycle if you don't think that it's important. So I hope that giving you all of this information, you're better able to understand endometriosis. It's not as scary, and you're able to explain it to other people with more confidence because you know what's going on in your body. So what is endometriosis? Endometriosis is a gynecological condition where the endometrium, or the uterine lining, grows in other areas of the body. Endometriosis is usually categorized as a gynecological condition, but to me it is a disease, because a disease is something that degenerates in the body, so it gets worse and worse and worse. To me, endometriosis is definitely a disease. It doesn't have a cure, and if you leave it alone, it gets worse. So for me, endometriosis should be categorized as a disease. So guys, we're going to talk a little bit now about how the menstrual cycle affects endometriosis. Well, let's start with a diagram of the reproductive organs, and you can see here the egg, ovary, the uterus, uterine lining, the vagina, and the fallopian tubes. So you guys are familiar with these terms as we go forward. The menstrual cycle has a 28-day span, and the main hormones that control the menstrual cycle are estrogen and progesterone. So we can see that from the chart here, at certain times throughout the month you will have higher levels of estrogen, and other times you will have higher levels of progesterone. And these changes in hormones actually lead to 4 stages of the menstrual cycle, and we will examine each one of them as we go forward. The first stage of the menstrual cycle is the follicular phase, which lasts from days 1 to days 13. What happens during the follicular phase is the follicle in the ovary starts maturing. The follicle is basically like an incubator for the egg. As the follicle matures, it releases estrogen. This estrogen in turn causes the uterine lining to slowly start building itself back up again, and blood flow to the uterus is also increased. The second phase of the menstrual cycle is the ovulation phase, and this occurs typically on day 14, but that can vary from one woman to the next. What happens during the ovulation phase is ovulation. There is a release of a hormone called the luteinizing hormone. This hormone causes the follicle to mature to the point where it bursts, and it then releases the egg. This follicle then turns into what is called corpus luteum, or the yellow body. The third stage of the menstrual cycle is the luteal phase, and this occurs from days 15 to days 28. What occurs during the luteal phase is that the corpus luteum, which we mentioned before, produces the hormone progesterone. This progesterone prepares the uterus in case of pregnancy. Progesterone causes the uterine lining to thicken, and it also helps to maintain the thickness of the uterine lining. It increases the blood supply to the uterus as well. If the egg is not fertilized, the corpus luteum dies. Progesterone levels in the blood fall, as well as the estrogen levels. Without the stimulation of progesterone, the uterine lining starts to shrink. The last phase of the menstrual cycle is the menstrual phase. This occurs typically from days 1 to days 5, but some women it can last up to day 7 or day 9. So the menstrual phase and the follicular phase, which is the first stage of the menstrual cycle, actually occur simultaneously. As the uterine lining shrinks, it causes the blood vessels that supply blood to the uterus to break. The bleeding that occurs causes the uterine lining to completely separate from the uterine wall. At this point, menstruation occurs, where the uterine lining as well as blood is shed through the vagina. Blood actually accounts for no more than half of the total menstrual discharge, with the other half actually being the uterine lining. It's been scientifically proven that women with endometriosis have an imbalance of hormones and that they have too much estrogen. They're estrogen dominant. So as I showed you the graph before, where it shows how the hormones should fluctuate and levels of estrogen sometimes should be below levels of progesterone, what you find in women with endometriosis is that there is always a dominance of estrogen in the body. What estrogen does is it restarts the same way that estrogen in the beginning of the menstrual cycle starts the lining of the uterus to slowly start to build itself back up again. In the same way, estrogen will restart all of the endometrial implants all over the body, because what happens is all these endometrial implants mimic exactly what is happening with the uterine lining. With estrogen dominant, these implants never get a chance to turn off. That's why doctors will give women with endometriosis medications like Depo-Provera to simulate pregnancy, because what happens during pregnancy is that progesterone is the dominant hormone that you have during pregnancy. So over that course of time, you would find that the estrogen in the body would diminish over time, and the implants will slowly starve because they're not having the food, the fuel that keeps them building and keeps them alive. So what progesterone does for these endometrial implants, we know that estrogen gets them to start building up again. Slowly the layers will build up just as it does in the uterus. And just as progesterone, it also causes these implants to swell as well. So they get bigger. So that's why you find for a lot of women that around ovulation and just after ovulation is where they normally start to feel pain with endometriosis, because that is when the lining is really starting to get thick and it's continuing throughout that period of time. Progesterone helps the smooth muscles of the uterus to relax. So when during the menstrual, when you're menstruating and progesterone drops, that's why women find that they can sometimes have such severe cramps when they are menstruating. So without progesterone, you find the muscles can tense up and cramp up and cause all of that pain that we normally have. Estrogen starts up the implants, and progesterone helps them to continue to grow and to get bigger. And then what happens when you have the menstrual bleed is that these implants bleed. So most women who have endometriosis find that they have pain just with their menstrual cycle, maybe the first couple of days or so. So you can look at endometriosis basically as having internal bleeding. That's basically what it is. So what happens is the body responds to this bleeding because it's something that shouldn't be there. And so the body responds to this by sending out white blood cells. You know that whenever you get a cut or whatever, the white blood cells are like our immune system. They're going to fight anything in the body that's not supposed to be there to keep us healthy. So blood is not supposed to be leaking out of your ovaries and around your ovaries. Blood is not supposed to be around your intestines. Blood is not supposed to be oozing out of your peritoneum and all the other places where women have endometrial implants. So the body responds to this bleeding by sending out those white blood cells, and those collection of white blood cells causes inflammation. That's what is inflammation. And the body responds to that inflammation by sending out pain signals to let you know, just generally speaking, this is how the body works. It lets you know that something is wrong by sending out pain signals. And so that's how women with endometriosis have pain, because the body knows that something is wrong, there's something going on there. We get inflammation, and that inflammation causes pain. Also, if any nerve endings are affected by the endometriosis, that too can intensify the pain. I'm going to show you a couple of images of what endometriosis looks like. And this is really good for you ladies to show your parents, sisters, brothers, boyfriends, anyone who maybe thinks that you're just overreacting and just being a drama queen. show them this picture, and I guarantee you they will have a better understanding, and you know, they will be a little more, they'll be kinder toward you. If they're not, then they're inhuman, and you shouldn't, just don't worry yourself about it. Just move on. So as we can see from this image, tissue that is affected by endometriosis looks quite diseased. And after a while of dealing with endometriosis, the constant bleeding and inflammation, it causes irreversible damage. So unless this area were surgically removed, there would be absolutely no way to return it to its former condition. Where women get endometrial implants is on the ovaries, the outside of the uterus, the peritoneal wall, which is the lining of the abdomen. The intestines is also a very common place for women to get endometriosis. Some of the more uncommon places to find endometriosis is the skin. You may have deposits on the skin where your skin may bleed and so on. The liver, the lungs. You find women who have endometriosis in the lung will actually cough up blood. Endometrial implants in the brain, and that can be fatal. So endometriosis is serious. In some cases, it is quite serious. You can have deposits in the hip area. You can have deposits on the sciatic nerve or on the hip bone itself. You can basically get endometrial implants anywhere in the body. Anywhere at all, you can have an endometrial implant. So endometriosis can go from the brain all the way down. So some of the common symptoms that women have with endometriosis is pain right before the period, pain with a menstrual cycle, pain with ovulation. You may have cramping. Abdominal swelling is also a very common symptom of endometriosis, and the swelling can get to the point where it can actually resemble pregnancy, as you can see from these pictures that I took of myself. Adhesions is another common aspect of endometriosis. These adhesions are webbing formed when the internal organs stick together because of the constant inflammation that is going on in the abdomen. These adhesions can cause pain and restrict movement in certain ways. Some of the more uncommon symptoms of endometriosis, like in my situation, you might find women who have pain every single day, who have severe chronic pain. That's not a common manifestation of endometriosis. So again, pain in the hip and pain in the leg, coughing up blood from the involvement in the lungs. You may have severe headaches and migraines for those women who have endometriosis in the brain. You know, possibly maybe seizures as well. So those are some of the more uncommon symptoms that you will find in women who have endometriosis. Now, what I will do, I will put a link in the description to a website go to again and again for information about endometriosis, because it's very timely. So it has a lot of information that a lot of other websites don't have, like about the more uncommon symptoms and more uncommon places where you can find endometriosis. So I will link that, the website Endo Resolved, I think that's the name of the website. It has extraordinary information about endometriosis. So I would encourage you to go to that website, and I will put that link in the description so you can go to it and just look up some of the symptoms as well, or any other thing that you're interested in with regard to endometriosis. So I truly hope that I was able to help you guys to understand what endometriosis is a bit better. Don't forget to like and subscribe. I've got videos coming up that will definitely be able to help you and your loved ones as well to understand different aspects of what it is like to have endometriosis. So thanks for watching. Bye-bye.